The next abstract is Association between Caregivers Depression with Adherence and Viral Suppression among HIV-Infected Children aged less than 10 years from Kenya. Dr. Agatha Kihiu from Kenya.
Hello, ladies and gentlemen. My name is Dr. Agatha Kihiu from Nairobi, Kenya. I'm here to present the findings of my study on the association between caregiver depression with adherence to ART and viral suppression among HIV-infected children aged 10 years and below in follow-up at the Kenyatta National Hospital. This was a cross-sectional study conducted among caregiver-child pairs who visited the comprehensive care clinic or the HIV clinic at the Kenyatta National Hospital during the study period. The main objectives of this study was to determine the prevalence of depression among caregivers of HIV-infected children, as well as to determine the association between caregiver depression and outcome of HIV-infected children, the outcome being HIV adherence to antiretroviral therapy, as well as viral suppression. The secondary objective was to determine the factors associated with caregiver depression. So we used the Patient Health Questionnaire 9 tool to determine the prevalence of depression, as well as the severity of depression. So using the Patient Health Questionnaire 9, we found a prevalence of 54%. This is the prevalence of depression. We went ahead and graded the severity of depression and found that majority of caregivers exhibited mild depression, followed by moderate depression, moderately severe amongst fewer participants, and none of the participants had severe depression. So we looked at the association between caregiver depression and adherence to antiretroviral therapy, and we found that caregivers who had mild depression had children who were more adherent or likely to be more adherent in comparison to those who had mild and moderate depression, whereby they had a higher likelihood of having children who are less adherent. We also looked at the association between caregiver depression and viral suppression and found that caregivers who had mild depression were more likely to have children who are virally suppressed, and the reverse was true. The opposite was true amongst caregivers who had moderately severe depression, whereby they were likely to have children who are not virally suppressed. So we looked at the factors associated with caregiver depression, and some of the factors that we looked at were the social support, stigma, level of education, socioeconomic status, marital status, HIV status, and we found significant association between marital status and depression among caregivers of HIV-infected children, whereby caregivers who were married had 87% less odds of being depressed compared to those who are single. Being HIV positive also had an association with being depressed, whereby caregivers who are HIV positive have 17 times higher likelihood of exhibiting depressive symptoms in comparison to those who are HIV negative. One of the main limitations of this study is that majority of the caregivers were female, and this could have influenced the findings or the outcomes of the study. So recommendation or way forward is that we conduct a more large-scale study, a case-controlled study, in order to validate the findings of this study. Thank you very much.